Hello and welcome to Maintaining Your Feet, a free class offered by the Wolf Creek Primary Care Network. My name is April. I am a foot care nurse in the Wolf Creek Primary Care Network, and today I'm going to be presenting this material to you. There's a lot of good information, so sit tight and get comfortable and be prepared to take some breaks so you can do some foot and ankle exercises throughout. And we hope you learned something today, and we'd love if you'd give us some feedback. We should be having a survey set up as well at the end of this. So welcome. Thank you for joining us, and being here is the first step to taking better care of your feet. This is our class agenda. So I am going to be reviewing some common health problems that lead to foot pain. We're going to be just reviewing some common foot problems, circulation and neuropathy, and how to help with that. We're going to review the 3 categories, which are skin problems and what to do, nail problems and what to do, foot structure problems and what to do. And we're also going to be reviewing footwear, preventative foot care tips, and how can you take care of your feet, modified foot care tips and tricks for people that struggle to reach their feet, and just a few other extra tips and tricks for you today. So have a look at this slide before we get started. Here's some pictures of some different tools that may be helpful for you. We are going to review all these tools throughout, and there is a section later on that does go over them. But just so you can see what some of them are, we have toe washers, extension mirrors, long-handled heel paddles, files, long-handled paint rollers for applying lotion, shoe horns. But we will review these. Thank you again for joining us. Let's get started. Common health problems leading to foot pain. First, let's review some of these common health problems that can lead to problems with your feet. Maybe you or your loved one may be experiencing some of these, and they may be causing you problems with pain and discomfort, affecting the way you walk, sleep, manage your feet, etc. So diabetes. For people with diabetes, having too much glucose or sugar in their blood for a long time can cause some serious complications, including foot problems. Diabetes can cause nerve damage, also known as neuropathy, and poor blood flow or circulation to the legs and feet, also known as peripheral arterial disease. As a result, people with diabetes are less likely to feel a foot injury, such as a blister or cut. There's also arthritis, bony prominences, bones shift with age and wear, causing pain. That is a common health problem leading to foot pain. And we have heart disease, hypertension, high cholesterol, edema, swelling, peripheral vascular disease. We'll describe a little more later. And chronic pain. Okay, chronic pain is a common health problem leading to foot pain. Here is a list of common foot problems that you've probably heard of. Maybe you struggle with some of these. Bunions, hammer toes, claw toes, mallet toes, corns and calluses, dry, cracked skin such as on the heels maybe, blisters, foot ulcers, ingrown toenails, fungal infections on the nail and the skin, plantar warts, plantar fasciitis, athlete's foot. Circulation. So healthy arteries, they send oxygenated blood away from the heart and help keep the tissues healthy in our feet. So signs and symptoms of healthy arteries are, the color of your skin is flesh tone, the temperature is warm throughout, there's good hair growth on the legs, the feet, and the toes, and your pulses in your feet are palpable. So some signs and symptoms of peripheral vascular disease or PVD. So we would see change in color of the skin or shiny skin on the legs. The temperature is cool, the legs are cold, maybe the feet are cold on one side only. The hair growth on the legs and feet is reduced from before. You might have some leg or foot pain, cramping and swelling after walking or on elevation. No pedal pulse or weak pulses in your feet. Slower nail growth and maybe sores on the toes or the legs, and they're not healing, okay? So PVD, it is a blood circulation disorder that causes blood vessels to narrow, block, or spasm, often in our legs. But the veins in your body, they push the deoxygenated blood back up to the heart, and they keep the circulatory system moving. And when the veins are not able to send the blood back up to the heart fast enough, an individual may experience swelling in the feet as the days go on. Oftentimes, relief is found by elevating the legs, and swelling is usually worse in the evening. And you can improve your circulation, okay? Some suggestions are walking regularly, of course. If you're finding you're sitting a lot during the day, get up every 15 to 30 minutes, walk around a little bit, elevate your feet throughout the day. That helps the veins. Some people wear compression stockings. That helps push the blood back up to the heart. And of course, you want to talk to your doctor about that. Some toe, foot, and ankle exercises when you're sitting or standing. You can pump the ankles up and down, wiggle the toes, point your toes up and down, rotate your ankles in a circle for 5 minutes. You can put a tea towel on the floor and grab it with your toes. And you can also hold on to a chair and just stand holding onto the back of the chair and go up and down on your toes. And if you can do these exercises for 5 minutes, at least a few times a day, that helps. Neuropathy. What is it? What can I do about it? Neuropathy is damage or dysfunction of one or more nerves that typically results in numbness, tingling, muscle weakness, and pain in the affected area. Some people describe it as pins and needles sometimes, as you can see in that picture at the top left-hand corner. Sometimes it's worse in the evenings, and there are many causes of peripheral neuropathy, including diabetes, chemo-induced neuropathy, hereditary disorders, inflammatory infections, autoimmune diseases, etc. But how can I help it? Well, it's a tricky one, to be honest, but some people do find relief by soaking their feet in lukewarm water and Epsom salts, but you don't want to have any open or even closed wounds, okay? 10 minutes maximum for soaking your feet. You can roll your foot on a ball to stimulate the nerves morning and night. You can massage your feet daily with lotion infused with lavender. Exercise can help relieve some discomfort for some people. And definitely you want to control your blood sugars if you have diabetes. And you do want to talk to your doctor because sometimes certain medications can help relieve some of that discomfort from neuropathy. Now we're going to talk about how foot problems fall into 3 categories. We have skin problems, nail problems, and foot structure problems. First, let's review skin problems and what to do. You can see here in these pictures, we have some dry skin, some calluses, some cracks to the bottom of the feet and the heels. This is a very common problem and you may be suffering from this. So let's talk about what you can do. So first, one of the main things that people forget to do and neglect is filing your heels, okay, at least once a week. So you're going to file your heels, calluses, or cracks with a clean heel paddle or emery board file. You can best to do it every other day to reduce the crusty buildup. This does work better when your feet are dry prior to showering. You want to apply lotion to your feet twice a day if they are looking pretty bad. Do not put lotion between your toes, okay? We don't want that moisture sitting in between there. You do, if your feet are cracked and calloused, you can use a moisturizer that has urea in it, 10 to 25% urea in it, and you can use that morning and night, okay? Some examples of moisturizer that you can get in the drugstores that has urea in it is Flexitol, we have Attractane, Uramol, or Dermal Therapy. Okay, they're just over-the-counter specialty lotions for very dry, calloused, and cracked skin. You also want to wear socks, okay, for at least an hour after the application of lotion. And you always want to wear clean socks in your shoes. Don't be using the files that look like cheese graters, okay? Those are very dangerous, especially for someone that has diabetes. The next thing we're going to talk about is athlete's foot, okay? It's a fungus that causes itching, redness, and cracking, peeling skin, commonly between toes and under toes, usually on the fifth little toe underneath and in between there. That's the common problem. You do need daily washing and drying well between all toes. You want to wear clean socks each day. You may need to talk to your doctor to recommend a medication for athlete's foot if it's not getting any better. There are also over-the-counter antifungal creams as well. Clean socks every day. Let your feet breathe when you're sitting down. Take your socks off. And absolutely no lotion between the toes. Okay, so there's a couple pictures of what athlete's foot can look like. Next, we're going to talk about corns. Okay, corns. So what is a corn? A corn is a buildup of hard skin, usually near a bony area of the toe or between the toes, okay? Corns may be a result of pressure from shoes that rub against the toes or cause friction between the toes. Proper care is necessary if you do have a corn. So after you bath or shower, you can use a pumice stone to gently remove the buildup of tissue. You do not want to use over-the-counter remedies to dissolve corns, okay? Do not try and cut out the corn or remove it with a sharp object. One thing to remember is a corn will likely keep coming back if you are wearing poorly fitting shoes or if your toes continue to rub together, okay? There are toe spacer options available in drugstores, and we do have some more information coming up on toe spacers here. On this page, we have some different options of toe spacers, different pad options, and there is so many more. You can find these in the different drugstores, okay? These are just some of the common ones that I see as a foot care nurse that do help with corns and calluses, okay? The one in the middle is called a toe crest, and that one's good for hammer toes, calluses on the tips of the toes, and the metatarsal pads there. There's also little silicone ones that are good for people that have bunions and their toes are rubbing together. And there's foam ones, different sizes, depending if you need it for your little toe or in between the great toe and the second toe. And there's little toque ones that you can just slide in place, and they have silicone on the inside, so they do stay put fairly well. And you just put your sock over all of these like you normally would, and you can wear them in your shoes, and they help prevent corns and calluses. Moving on, we're on talking about foot ulcers and foot sores. Okay, this is a very common problem that we see, especially in individuals that have diabetes. Now, as you can see on the screen, calluses can often lead to foot ulcers and sores, especially if you have diabetes. Foot ulcers and sores can lead to infections and toe or foot amputations. 85% of foot amputations can be avoided through good foot care and footwear. So that is a big number, okay? 85% of these can be avoided, and it's through good foot care and footwear, and that is why we are educating you today on taking care of your feet. Now, also about foot ulcers. So you're wondering, what is a foot ulcer exactly? Okay, how do I get it? A foot ulcer, it's a break in the skin or a deep sore which can become infected. Foot ulcers can result in minor scrapes, cuts that heal slowly, or from rubbing of shoes that do not fit or support your feet well, causing like a callus buildup. So early intervention is important in treatment. And I do want to encourage you to ask your doctor for advice on how to best care for your wound if you do happen to have one, okay? And also I do want to mention, do you have diabetes? And if you do, are you getting your feet looked at? Are they being screened? Now, with our primary care network in our Wolf Creek area, we do diabetic foot screens, okay? And those are available for people that have diabetes. And we want to encourage you to get your feet looked at least once a year. Sooner if you have any problems, of course. We have foot care nurses in various different communities. But if we do this foot screen, and it doesn't take very long, okay? This diabetic foot screen, what it tells us what risk category you are for developing a foot ulcer, okay? You might be a low risk, you might be a moderate risk, or you might be a high risk. And that is good information for us to know so we can help you avoid this very not good problem, a foot ulcer, okay? Nail problems and what to do. One of the most common nail issues that we come across is a fungal nail infection, which is also known as onychomycosis. So what are some of the signs of nail fungus? We often see brittle looking nails, debris trapped underneath the nail that demonstrates to be loose or lifting, thickened nails or crumbling edges, and of course white or yellow discoloring on the nail. And some of the reasons why people may get it are minor skin or nail injuries, contact with an infected person, or sharing nail clippers or tools, a history of athlete's foot, excessive perspiration, warm climates and moist environments, wearing closed-toed shoes made of material that doesn't breathe, walking barefoot in damp areas such as swimming pools, home and hotel showers. And just so you know, 1 in 5 Canadians are affected by this nail fungus. 1 in 3 people who have diabetes generally will get it, and individuals who are immunosuppressed are more prone to it. So what is toenail fungus exactly? It is an infection in the nail, and it can be quite difficult to get rid of, especially if it's fairly advanced. So please talk to your doctor if you think you may have it. There are different treatment options, both prescription and over the counter, but they are not super effective. But it is worth treating, because if it is left untreated over the years, it does spread and it gets worse, and it can cause sores underneath the nail and often does cause ingrown toenail infections. Treatment options. So if you're not treating it with an antifungal medication prescribed by your doctor, some things that you can do, you can dab or spray vinegar water, so half-half. You can use white or apple cider vinegar onto all toenails daily. So half vinegar, half water. This can help dry out the fungus and keep it from spreading. It can make the nail more manageable. And other options are dabbing tea tree oil or Vicks vapor rub on the affected nail daily. An important thing to remember is to file down the nail thickness, if any thickness, to keep it from building up, okay? Spreading and making it more manageable to treat. Filing that thickness is very important. You also don't want to wear old shoes that may harbor fungal spores, and you want to make sure you're wearing clean, dry socks daily. You can wear sandals in public showers, pools, or locker rooms. Make sure you do not share your clippers or your nail files with other family members. Okay, disinfect clipper after each time you use it. There are different kinds of toenail fungus, and they do respond differently to various options. Okay, so it can be a little trial and error to see what works, is making a difference. I would recommend try something for a month at a time and see if it makes a difference in the way the nail is looking. But do talk to your doctor if you're concerned that you may have it, and your doctor may want to take a little clipping of the nail and send it away to the lab. Some toenail fungus tends to come back even if there was some success at getting rid of it. Okay, it ends up being a lifelong problem for a lot of people, but preventing the complications such as ingrown toenails and sores, that is key. You may never get rid of it, but you can definitely manage it to prevent it from getting worse and causing problems. Ingrown toenails. Ingrown toenails occur when the edges of the nail grow into the skin and start to curl around. They cause pressure and pain along the nail edges. The edge of the nail may cut into the skin, causing redness, swelling, pain, drainage, and infection. The most common causes of ingrown toenails are pressure from your shoes, peeling your toenails, cutting your toenails too short, toenail deformity due to injury or fungus, and genetics. An involuted versus ingrown toenail. So an ingrown toenail, it breaks the skin and can get infected, whereas an involuted toenail curls up like a U. So help, what is the best way to avoid an ingrown toenail? Definitely proper trimming of your toenails is very important, and we're going to talk more on this soon. You want to keep any thickened nail filed down to prevent pressure on the edges. And no peeling your toenail off. And you want to make sure your shoes are fitting properly. Next up is common foot structure problems and what to do. Bunions, hammer toes, claw, and mallet toes. Have you heard those names before? Maybe you have those. So description of some of those are, they are structural deformities due to bony prominences. So they can force toes to crowd and rub together and cause rubbing on the side of the shoe as well. And they can cause overlapping of the first and second toes. Causes of these are genetics, of course, arthritis, wearing narrow shoes, high heels, or shoes that are too tight and not supportive. But what can you do about that? You can, of course, wear properly fitted shoes. A lot of times when someone has a bunion, they need to be wearing wider shoes. Definitely you want to avoid high heels. You can try over-the-counter toe spacers and pad options, okay? Orthotics can help to remove pressure on the pads of the foot and provide better support to stop the callousing from developing. You can have leather shoes stretched at the bunion area. Surgical interventions may also be an option if it's painful and affecting the way you're walking. You definitely do want to see a podiatrist or a podorthist for footwear adjustments or other interventions. So here's that same slide we looked at before with the toe spacer pad options. Now, plantar fasciitis. So plantar fasciitis is heel pain, and it's a common problem as well. There are some exercises and stretches to help. Example, you can roll a tennis ball under the foot or a frozen water bottle under the foot every morning and night. And definitely you need proper fitted and supportive shoes indoors and outdoors. Okay, that will help a lot when you have plantar fasciitis. Footwear tips. What to look for and how to shop for a supportive, good-fitting shoe for indoors and outdoors. So some tips on footwear are, number 1, buy shoes later in the day where your feet are the most swollen. Number 2, have a professional fit your shoes for you if they're available. Number 3, the inner sole of the shoe should be removable so it can accommodate a shoe insert or orthotic. Number 4, laces or Velcro are best to adjust the tightness. Number 5, the heel cup should be stiff when pinched to support your heel properly. It should not, when you pinch the heel cup of the shoe, it should not be flimsy and fold all the way in. It should be stiff. Number 6, the shoes should not bend in half. So if you take the shoe and try to bend it in half from the toe to the heel, it should not bend in half, okay? Number 7, walk in the store with the new shoe on for a minimum of 15 minutes to test the fit of the shoes. Number 8, don't forget to clean inside of your shoes periodically. The inner sole can be removed and it can be washed with mild soap and water and then air dried. And you can also use a peroxide spray and wipe them clean that way. Number 9, if you have a new orthotic insert that you had professionally made for you, make sure you wear it for, about an hour a day and slowly increase that time. It definitely can take a long time to get used to. On my recent orthotics that I got, it took me a month to get used to them. Every time I wore them, up until about a month, I did not like them at first, okay? And now I put them on, I put my shoes on, and I don't even notice they're there because I had to adjust to them and learn to walk a little bit differently. And remember, it is very important to replace your shoes if they're getting worn down on the tread or if there's holes in the fabric or in the sole. Even if they do feel comfortable, you should still replace them or you may be prone to injuries, okay? Also, if you do have a callus or corn on your foot, it is very likely your shoes are not fitting properly and not supporting you enough. Now, if you look at this slide, you can see how there is an orthotic insert, and you can see how there's an arch support on there and how it's going to support that foot, okay? And you do definitely want to be supporting your feet because as we age, those little bones will start to shift around, and especially if there's any arthritis or any other issues, those little bones will shift around. And so make sure, if you're not finding the best fitted shoe or insert just in the stores, make sure you do talk to a podiatrist or an orthotist who specializes in making orthotics just for you. It's also really important to have an orthotic, a professionally made orthotic if you have any structural changes to your feet. Let's talk about socks. Always wear socks in your shoes. White or gray color is best because you can see the blood on your socks. Some people that have diabetes don't feel if they injure their foot, but they can notice the red blood color on their sock when they change their socks. Socks do provide extra protection and support for your feet, especially in the arch. They reduce your chance of blisters or corns, and socks do act as a barrier in your shoes. Socks should not be restricting or leaving indents in your skin. So diabetic socks are a great option if you're having any swelling. If your feet have any moisture during the day, you can try a merino wool or Cool Max material, as they absorb moisture and help keep your skin dry. Preventative foot care. Healthy feet start with you properly taking care of them. People often forget their feet need to be cared for, and that starts with some basic steps. Things to think about. Take a good look at your feet every day. You can use a hand mirror or extended mirror if you're unable to get them up close enough to you. You can check for open areas, cracked skin, calluses, and anything that appears abnormal. Have you washed your feet today? Look at your toenails. Do they need to be trimmed? Are they growing long over the end of the toe? Are they rubbing on your shoes or catching on your sheets lately? Do you have a functioning nail clipper that you can use? Has it been used on someone else in the house? Is it clean, or is it just my own? When cutting your toenails, trim them fairly straight across. Do not trim them far down into the corners. And just because there is white at the end of the toenail does not always mean it needs trimming. Shorter is not always better. A lot of people are notorious for cutting their nails too short. You can file your nails using a disposable single-use emery board to remove the rough, sharp edges. And when you file, go in one direction only. Going back and forth can cause the nail to splinter and peel. Use a paddle file to remove any rough, dry skin on heels or pads of the feet. Wash and dry your feet well, making sure to get in between the toes. And you can apply lotion to the dry areas, including your ankles and your heels, and not between your toes. And then put socks on. If you have diabetes, you should definitely see a foot care professional at least once a year for a diabetic foot assessment or a foot screen. And if you need foot care, it's always a good idea to talk to a foot nurse as well. Make sure you check your feet daily, and just because you don't feel a problem does not mean there isn't one. Modified foot care tips coming up. I love this section. Do you have problems reaching your feet? Many people have different reasons why they can't take care of their feet. Example, maybe they have back pain, or they're overweight. Maybe they've had hip surgery and they can't bend past the 90 degrees. Maybe they get dizzy when they're bending over. Maybe they have arthritis in the hands and the shoulders, etc. But these are common problems foot nurses hear, which lead to neglect and problematic feet. But there are some simple ways you can learn to start taking better care of your feet. So let's go over some suggestions and tips. I do want to say foot care is something that you should maintain daily. However, of course, there is another big factor that we already discussed earlier that really affects your foot health, and that is footwear as well. So, are you struggling to reach your feet? There still is ways that you can take care of your feet, okay? There definitely is. Many people struggle with reaching their feet and still can manage to take care of the basic care, all right? So let's review some of the things. So looking at your feet, you can use an extension mirror. You can even use a selfie stick, your phone with a picture if you feel that's something you can do. But a hand mirror on the ground is something that works really well. Washing your feet and washing between the toes. You can use a long-handled sponge brush. So, and also while you're sitting on a chair in the tub, you can plug the drain. You can use a long-handled shower head to wash your feet. You can make a lot of different tools at home by duct taping, a paint stick or a long handle onto something, okay, like a sponge brush or something, okay. Drying between your toes. Toe dryers can be purchased from different drugstores, or you can make your own with a paint stick and a J cloth. You can take an elastic and wrap it around the cloth at the end. Hair dryer, you can use the hair dryer on the coolest setting, and if you're using it, a comfortable distance from your foot. Applying lotion to your feet. This is an interesting one. You can use a plastic bag on the floor. You can put lotion on the plastic bag, rub your feet on the bag on the floor. Or you can use a long-handled paint roller with plastic wrap around it and lotion on the end, and change the plastic wrap with lotion every time you use it. A long-handled paintbrush, that works really good. And it rolls on really nicely. Putting on your socks and shoes. Of course, there's, a sock helper you can purchase from drugstores. Shoe horns are very helpful as well. Putting on compression stockings. There are Donner, Doffer, Magnite tools available. Now, trimming your own toenails. One trick that works for a lot of people is instead of bending over for long periods of time where you might get dizzy or short of breath, try just trimming one toenail a day. It's a quick thing and you don't have to be bending over for a long time. But, if you have poor vision, you likely will have to get a family member to assist you with some nail trimming. But also if you do have problematic nails that need more assistance, or there's no family member to help you, you can get a private foot nurse for regular nail care in your home or sometimes out of a clinic. That is something you do have to pay for. Filing your heels and calluses. So you can duct tape a paint stick on a heel paddle. You can get heel paddles, files from the dollar stores, drugstores, or you can use a clean sanding block and duct tape a handle onto that. Okay, there are some easy ways you can still manage your feet. Don't just neglect them until you end up with problems. What about a pedicure? Are they safe? If you have diabetes or you're prone to infections, it is very important to protect and educate yourself on potential complications. While complications aren't common, you should be aware that you may be exposing yourself to plantar warts, athlete's foot, toenail fungus, Hep B and C, HIV, and staph infections. Some questions to ask when booking an appointment for a pedicure are, you can call them and ask them, do you autoclave your tools and use sterile or disposable tools with each client? The answer should be yes. If they don't know what an autoclave is, that's a bad sign. That's the machine that sterilizes all the instruments in their individual packages, okay? Question number 2, are the emery boards one-time use or sterilized in your autoclave at 270 degrees? The answer should be yes. Do you use disposable basin liners? The answer should be yes. Some other suggestions: if you decide to go for a pedicure, do not shave your legs within 24 hours of a pedicure, as the pores of your skin may be open and allow entry of bacteria. You want to avoid paraffin wax treatments. This treatment could cause blistering of your skin and leave your skin open and prone to infection. No Credo blades or cheese grater type scrapers, especially on someone with diabetes. If you have any open areas to lower legs or your foot, it is best not to have a pedicure, as your risk for infection increases even more. And just so you know, private foot care nurses are available in the community to help you with your foot care needs, and they have a nursing background, and they are required to be using sterile to the point of use foot tools or your own set. Wow, now you're a foot pro after all that information. You made it to the end. Congratulations. The Wolf Creek Primary Care Network appreciates you choosing to take the time to educate yourself on maintaining healthy feet. We hope you learn lots from this class, and we would truly appreciate any feedback you may have for us to help us improve our virtual education. Thank you for joining us.